Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. At least 1.5 million Americans have lupus, and more than 16,000 new cases are reported annually across the country. May marks National Lupus Awareness Month. The goal is to increase public understanding of this cruel and mysterious disease, and that's exactly what we plan to do today. My next guests are perfect individuals to help us better understand lupus and its effects. Dr. Felicia Robertson is a family practitioner at Aurora Healthcare, and Regina Boston-Dixon, she's a board member of the Lupus Foundation of America Wisconsin chapter and a lupus warrior. Good morning, ladies.
Good morning.
Thank you for being here. All the pretty purple.
Thank you for having us.
And purple is the color for lupus awareness.
Correct.
So we're going to talk about a lot of interesting things today, but I first wanted to start with Dr. Robertson. Can we begin with you giving us a better idea of what lupus is and how it does affect the human body?
Sure. Lupus is an autoimmune disease, which means the body itself fights against itself. So ordinarily, our immune system will fight against viruses or bacteria. With autoimmune disease, it can't detect what's foreign versus what's innate. And therefore, lots of inflammation can occur and the myriad of symptoms can follow. So it's a chronic disease that can have exacerbations.
Any part of the body can become inflamed?
Absolutely.
Wow. So it can be very painful, needless to say. And lupus strikes mostly women of childbearing age, 15 to 44, but also you've got teenagers and children and men who can also develop lupus.
Yes.
Okay, interesting enough. Regina, you've been described as a lupus warrior, so if you would explain what that is.
What a lupus warrior is someone who is suffering from the disease of lupus, but because no one really understands what lupus is, they never realize that you're actually sick. Lupus is a disease of 1,000 disguises, so if you don't look like you're sick, no one would ever know that this is a disease that you're fighting with. And I think we're warriors because we're fighting for understanding, and we're fighting for people to know that we need your support, we need your help, we need your assistance to just make people aware of what lupus is. You know, the motto right now for the Lupus Foundation of America is to know lupus. Once you know lupus, K-N-O-W, lupus, there will be no more lupus. So we're just fighting for information, spread awareness, and let people understand that someone with lupus can actually be on chemotherapy as well. And that's something that a lot of people don't know, so they don't actually take the time to understand it.
Well, that's why you're here today. And you know, I look at situations, you have Toni Braxton who suffers from lupus, and when you have someone with that type of celebrity who has talked about it, been a spokesperson, all of those different things, it really does help with spreading awareness. And she has been a trooper in dealing with that and heart disease, and she really, along with many other people, are helping the masses know what it is and better understand. So Dr. Robertson, women of color are 2 times likely to develop lupus than Caucasians. So do we know why that is?
It's a myriad of different triggers. Genetics plays a small part. Having said that, stress, and heaven knows, women of color have more stress. So it's not just African Americans who have higher numbers, Latina as well, Asian also, Native Americans also.
So minority women, okay. And Regina, when did you first get diagnosed with lupus, and what has your journey been like in getting to where you are today?
I was actually first officially diagnosed with lupus about 23 years old. However, I've displayed symptoms of lupus as a child. As a matter of fact, I was in college, I was going to Howard University, was one of the times that I had a really bad flare-up. I received scars and rashes across my face, went to the hospital several times, no one knew what to do. I ended up coming home to see my dermatologist. However, the docs were still never connected because I only talked about my skin issues. As I began to get older, I started displaying other issues, having muscle weaknesses, I was always known to be sensitive to the sun as a little child. My mom would always say, you know, this young lady, she can't be out in the sun, because she would always get red and rashy. So it was just kind of one of those things that all of the doctors never talked. And it was over probably about 5 or 6 years after that that they officially connected the dots. I've been dealing with this particular disease for over 17 years. And so back then there was nothing there was no World Wide Web, there was nothing or no information or support groups about this. And it was also during the time of the AIDS epidemic. So some of the symptoms would be the same or similar to AIDS patients. So you never talked about it. You didn't want anyone to think that you had AIDS.
Yeah, and that's why they're saying it's such a mystery, because doctor, it's hard for individuals like yourself to be able to diagnose someone with lupus.
And certainly that's where having a primary care doctor and continuity of care makes a huge difference, because the different symptoms, we can look back over the chart and say, well, we talked about fatigue. This fatigue is, your thyroid's normal, your glucose is normal, these other labs are normal, what else is going on? And then she'd mention, you know, the joint aches and other symptoms, and then you start to say, wow, these are, or the light sensitivity, these are really sounding like this. Let's check some lab work.
Okay, and so with that said, let's kind of talk about some of the symptoms, because she did mention a list of things that she went through, but these rashes are sometimes shaped like a butterfly, and people can get them on their face, nose, whatever the case, and so that would be a telltale sign.
Absolutely, if someone's paying attention.
Yeah.
And so what are some of the other symptoms that people should, at least if they've gone to a doctor a million times for certain things, they can connect these dots as we speak and maybe say, hey, can you check me for lupus?
Sure.
So what are some of the things people probably should be aware of?
So we talked about the fatigue, the muscle aches, joint aches for sure. Swelling of the joints would also be one of the symptoms. What else have you had?
Actually, some of the things are feeling, just chronic fatigue is my biggest thing, muscle swelling, light sensitivity, just having abnormal rashes, sores, you know, you might get a cold sore or something. I also used to always just feel hot. I would always have a fever. For no apparent reason, I wouldn't have a cold or anything, but I would always be running a fever. Someone would hug me and they'd be like, wow, you're warm.
Wow.
It was just normal for me, and not realizing that all of those things were underlying symptoms.
All right, well, hopefully just us having this conversation will help someone. Somebody's going, aha, because probably someone, like I said, along the way, they've had a little bit of all of it and have not been able to connect those dots. I did mention that purple is the color for lupus awareness, and May, as we're wrapping up the month, is Lupus Awareness Month. In your opinion, what's the most important thing for people to take away today when it comes to what they know about lupus?
Well, one of the most important things I would say that people need to do is find out. Know what it is. Know what you're looking for, but not only that, not just for the people that are diagnosed with lupus, I'm talking about more or less the caregivers and the advocates, because speaking personally, I used to tell people I have lupus, they had no idea what that meant. However, they didn't know how to support me. So if there was someone that didn't know how to support me, I would just never let them know when I was sick. It was always something that I hid from my family. And to be honest, when you talked about Toni Braxton, when she came out and said, I have lupus, that's actually when I got the courage to actually say, I have this, and now I don't want someone else or someone younger who's dealing with this disease to be alone. So that they can know that there's people out there who's dealing with this particular disease, and what resources that are out there to help them, so that the families can understand how they can help someone who's dealing with lupus. And just because they look sick, they're not faint and they haven't fallen out, and they may just say, I'm very tired. Please understand that they are actually really tired, you know, just probably at your worst. multiply that by 50, then you'll understand how tired they actually are.
Wow. So I mentioned early on that you're a member of the board for the Lupus Foundation of America, Wisconsin chapter. Quickly, if you could tell us a little bit about the foundation and what it does.
Okay, what the Lupus Foundation of America, Wisconsin chapter do, we are actually combined with the national chapter, and our goal is basically to help fund different research as well as do as much outreach and awareness as we can. During the month of May, we've had a Put on Purple event. There's also a number of walks that we're having, and a big thing is we have our walk coming out that we would like people to take part of it.
And you're speaking of the Walk to End Lupus Now. And that's happening on Saturday or Sunday, June 12th.
Correct.
And so we're going to put that information on the screen right now. The registration begins at 10:30. The walk begins at noon, and that's happening where?
That's going to be happening at Hart Park in Wauwatosa. You can either do a 1.5 mile walk or a 3 mile walk. It's not necessarily a running event because there's a number of patients who can't run. So it's not it's not that type of walk. However, we also have a memorial signs that are put out throughout the trail where you're honoring someone who's dealing with lupus, as well as a memorial for those who have lost their lives due to lupus. We have a special corner this year, which is a Warriors Corner, where it highlights different stories of many different people who have lupus.
Yes, and you have a pre-registration that's taking place now through June 7th that includes a 15th anniversary t-shirt, and then people can also register on the day of. So the phone number to call for more information, 414-443-6400, or log on to lupus.org/Wisconsin. One last thing that's important when we talk about foundations and things of that nature, donations are always a huge thing. So if someone can't necessarily make it out to a walk and do it that way, then they can most certainly write a check and help make a difference in solving this mysterious autoimmune disease.
And if you register with the team, you don't have to physically be there. We actually have cyber walks. So you can register team, you can donate and have a different team rivalry here, and basically just see who can raise the most money.
It sounds good to me. And something she said, doctor, as we wrap up, she said people have lost their lives to lupus. So this is not just a disease that people live with and they just kind of hurt every now and then. It really does claim lives each and every day.
Absolutely. It's very serious, and certainly African Americans have the more serious types of complications associated with that. Increased risk 50 times of heart disease itself because of the inflammation, kidney disease as well, increased risk of other cardio risk factors. So watching the blood pressure, diabetes risk, and of course, if you're fatigued and you have pain, who feels like exercising?
That's the truth. Right. Wow. Thank you both so much for coming by. I appreciate all the great information. Dr. Felicia Robertson is a family practitioner at Aurora Healthcare, and Regina Boston-Dixon, she's a board member of the Lupus Foundation of America Wisconsin chapter and a lupus warrior. For more information on anything we've discussed, you can again log on to lupus.org/Wisconsin or call 443-6400. That's going to do it for today's show. I'm your host, Andrea Williams. As always, I thank you for watching, and I do hope you join us again next week as we take another look at our issues in Milwaukee. Have a great day.